Welcome to the OVA vlog. We are talking about women's reproductive cancers. So we're actually doing a 3-part series. We're going to be going over uterine cancer, cervical cancer, and ovarian cancer. And we're joined by 2 rock stars, Dr. Song, who studies, you've been trained as an OBGYN, and are now, she's now researching women's reproductive cancers.
Yes.
And we're joined by Erica Schnettler, who is a PhD student at the University of Minnesota. And welcome, ladies.
Thank you. I'm, like Elise said, I'm a graduate student here, and our lab, we study ovarian cancer, different therapies to treat ovarian cancer, and just ovarian cancer biology in general. So that's what we study. And again, I'm Mihe Song. I'm one of the gynecological oncology fellow. So I'm just specializing in this field of gynecologic cancer, reproductive women's cancer.
Thank you guys for joining us.
Thank you.
So to get started, we're actually going to talk about uterine cancer first. So what is uterine cancer?
So uterine cancer begins in different parts of the uterus. So there's 2 main parts of the uterus. So there is the lining of the uterus, which is called the endometrium, which is the most common form of uterine cancer. And then there's cancers that start in the muscle part of the uterus, which is called the sarcoma, which is a little bit more rare than the endometrial cancer. So there are different parts.
And what are some symptoms that women will experience when they have uterine cancer?
So the most common symptom of uterine cancer is abnormal vaginal bleeding. So anytime you have your period that's a little bit heavier than normal, and it's been going on for a while, or if you have postmenopausal bleeding, you've had menopause for many years, and all of a sudden you have an episode of vaginal bleeding, those are signs to watch out for.
So most cases of uterine cancer in postmenopausal women?
Yes.
Okay.
And they occur in the endometrium of the uterus. So about 60,000 women are diagnosed every year with uterine cancer.
Okay.
So it's one of the most common gynecologic cancers that are diagnosed every year.
Wow,
That's a lot.
60,
Yep.
yeah, 60,000. So what are some of the screening techniques for uterine cancer?
So unfortunately, like cervical cancer, we have the pap smear. There really is no good screening for endometrial or uterine cancer. Again, typically patients go in with vaginal bleeding or these symptoms, and if a doctor suspects that a patient might have endometrial cancer or uterine cancer, there are a few things that can be done, like an endometrial biopsy or transvaginal ultrasound, but there really is no screening. Mostly you're just going in to detect the cancer.
And are there advancements right now in treating uterine cancer?
Yeah, there have been a few advancements. So typical treatment right now is mostly surgery to remove the cancer, radiation, as well as chemotherapy. There have been some surgical advancements, I would say, that have helped the field a lot. So Mihe, I know, has used some of these robots, but they have these minimally invasive robots that can remove the cancer, and they just make very small incisions, so you can remove the cancer without having to open the patient up or being very invasive. So recovery time's a lot faster, and I think it's easier for both the patient and probably you guys as well. Yeah, but mostly for the patient. They definitely recover faster. They don't stay in the hospital as long. The pain is much better controlled.
So what's the prognosis with the uterine cancer? Like how is it pretty successful when it's diagnosed to treat it?
Yeah. So most people come because they come with a symptom of vaginal bleeding and they get worked up pretty quickly. They usually come with really early stage endometrial cancer, which is good news, which means that most women get cured just by surgery alone. So unless they come in with advanced stage, which has spread to other parts of the body, radiation, chemotherapy are those adjuvant therapies. But the 5-year prognosis is very good for these women.
Excellent. Well, thank you so much, and stay tuned for our next episode all about cervical cancer.